Hello everyone. One of the common conditions which we see nowadays in our practice is endometriosis. And we get a lot of queries, some of which are very common, and I thought I'll throw some light on them to make your doubts clear. So first, we all need to know what is endometriosis. Endometriosis is a condition when inner lining of the uterus, which is supposed to be shed off every month in menses, due to some hormonal imbalance, a lot of theories are there why it happens. It goes, rather than coming out, it may go backwards through the tube and get deposited in the organs nearby. Now, how do you know you have endometriosis? Pain is a feature of menses which most girls and women have. It's okay to have mild pain which gets corrected just by resting or maybe a simple painkiller. But any pain which is so severe that you have to go to the hospital for injections and you have to repeatedly take analgesic medicines, and you get vomitings and your studies or your office is affected, then one should start suspecting that maybe I'm suffering from endometriosis. So the typical feature of endometriosis is pain. Pain can be during menses, it can be after menses. Means when most of the pain, normal pain, gets cured, like first, second day it is there, and as the bleeding flow starts, the pain gets corrected. Whereas in endometriosis, the pain may continue for 3 to 4 days and may persist for few more days after the periods. This is because the abnormal lining which has gone inside may continue to cause irritation and pain to the patient. Second kind of pain may be that in between menses, a patient gets pain, like irrespective of the dates of menses. This happens with advanced disease, that throughout the month, almost intermittently, anytime she can have pain with no relation to menses. The third common thing is pain during intercourse. So these are the things which should start putting that doubt in your mind, and you should see a doctor in that case. Now, how do we diagnose endometriosis? How do we confirm when you come to us? So one is clinical history of the patient and examination. When we do, especially in the married women, when we do internal examination, there are certain features by which we can say that there is a possibility of endometriosis. Ultrasound is available everywhere nowadays, so that can easily be done, and that can give us some idea about whether the cases of endometriosis or not. But again, as I said, early endometriosis may not be picked up even on ultrasound. So most important thing to diagnose or to confirm that a patient has endometriosis is typical symptoms which get aggravated during periods. And as the disease advances, one may have pain while passing stools, while passing urine, and there can be some rare presentations as well. And many women who have never had pain, they come to us because they're not able to conceive, and during their investigations, we find that they have endometriosis. Is it cancer? Can it lead to cancer? My answer to that is, see, anything in body can be cancerous. Endometriosis has a very low chance of converting into cancer. So don't get worried. There are many more things which can happen with endometriosis. Cancer is one of the rarest complications which can happen. So the other fear they have is, if I ignore the pain, can anything go wrong with me? My life is affected. So it's not a life-threatening disease, but definitely it compromises your quality of life. So quality of life is very important nowadays. And so when a patient comes to us, our main aim is to relieve her of her symptoms and to give her a better quality of life and to arrest the disease as much as we can. Now, the next thought which would come into your mind is, can there be any diet or a lifestyle change which I can do to correct the disease or to stop the disease? To some extent, yes. Basically, you have to understand the disease. It's a hormone-dependent disease. It depends on female hormone, that is the estrogen. So it happens only in women who are having menses. Once a woman achieves menopause, her disease will automatically go away. So that is one respite they get at the fag end of life once they achieve menopause. But other things which can go wrong are, the disease is something which spreads and involves the neighboring organs as well. So once it comes to the ovaries, it can compromise the number of eggs you have for getting pregnant in life. So it affects the ovary. It can reduce the number of eggs available for fertility. It can lead to infertility. Secondly, if it involves the intestines all around, you may have symptoms, and the intestine gets pulled, the bladder may get affected, the ureters, the pipes which carry urine from kidneys to the bladder, they can get involved. So, and each one can produce its own kind of symptoms depending on what the involvement is. The ovaries may get stuck to the uterus, so that can lead to severe pain during menses and even during intercourse. Now, coming to how do you treat endometriosis? So we have various options. One is medical option, medical treatment, surgical treatment, combination of the two. But everything depends upon the doctor sits and charts out a plan for you. It will depend if you are falling in the young girls category, if you are in your from 16 to 25, 26 years of age, your concern would be mainly pain. But we as doctors understand that you, along with pain, your ovaries may get affected, and in future you have to conceive. So we'll give you something to relieve your pain, which can be anything. It could be hormonal or non-hormonal. Don't worry about hormonal. People are worried about taking hormones, but you have to understand it is a hormonal problem. So most of the time, a hormone will be required to correct it. So we start usually with simple painkillers. If they don't help, we switch over to birth control pills, and then there are other kinds of non-hormonal pills. Many of them have proven safe, and we've been using them for quite some time now, many years. There are once a month injections also, but then every patient has to be seen by the doctor, and accordingly, the decision for treatment has to be taken. A woman who's from mid-20s to late 30s, that is the time to have children. So here the concern is, along with pain or with or without pain, a woman may be having fertility issues. So here I cannot give anything to suppress her hormones because I want her to produce eggs and get pregnant. So this is the time treatment will focus mainly on fertility and to make her, help her in getting pregnant as early as possible. A woman who's nearing menopause in her 40s, maybe who has completed her family and has grown up children, we can try various options. If she's very close to menopause, we can just pull on so that she reaches menopause, and after that the disease is going to have its own cure. So the treatment has to be charted and planned, sitting with you and understanding your needs. If you at all you end up requiring surgery, surgery is not the first line of treatment, but there are certain indications where surgery is required. So in young girls, we avoid doing surgery as much as possible. And surgery should be done when you are almost ready to have a child. So if you want to have a child and you have a big cyst in the ovary, probably doctor may want to operate. That will again depend on your particular case. But when you are undergoing surgery, you have to do a lot of search. Find out who's a good surgeon, because first surgery is the best surgery. And when the doctor goes inside with the laparoscope, there can be anything. It could be totally frozen. Your intestines could be stuck. Your ureters, your bladder could be stuck. So the surgery has to be done by a very, very experienced surgeon who does endometriosis surgeries very well. And there should be a multidisciplinary or a place you inquire with your doctor. In case of need, a urologist, a general surgeon, a bowel surgeon may be required in very difficult cases. Or the doctor herself or himself may be competent enough to do it. So make your decision judiciously when you require surgery. And again, to tell you, not every patient requires surgery. Endometriosis is difficult to treat, but treatment is possible for everything. So don't worry, and you will definitely find a cure for your disease.